Good afternoon. As the Canadian scientist William Osler once observed, the desire to take medicine is perhaps the greatest feature which distinguishes man from animals. Whether cooperating across borders or focusing on a range of specific issues, the requirement for an international effort is playing an increasingly substantial role. Today, we focus on three issues related to health diplomacy, namely the Global Fund, combating the spread of Ebola and AIDS, and age-related health diplomacy. We begin with a special report on the Global Fund from Mr. Titus Ndunda.
Global Fund is one of the global health diplomacy programs. Global Fund is providing life-saving medications to many people in the world. The Global Fund to fight AIDS, tuberculosis and malaria was created to dramatically increase resources to fight three of the world's most devastating diseases and direct those resources to areas of greatest need. Since its creation in 2002, the Global Fund has become the dominant financier of programs to fight AIDS, tuberculosis and malaria with approved funding of $21.7 billion for more than 600 programs. And in more than 150 countries, of which Kenya is one of them. The fund is supported from donations from countries, foundations, and individuals. The US government is to date the first major contributor, followed by the government of France. To date, the programs supported by the Global Fund worldwide have saved over 6.5 million lives through providing AIDS treatment for over 3 million people, anti-tuberculosis treatment for over 7.7 million people, and the distribution of about 160 million long-lasting insecticide-treated bed nets for the prevention of malaria. The Global Fund financial activity in Kenya has been a great success and has enabled the country to strengthen their health system by making improvement to infrastructures and providing training to those who deliver services. The Global Fund continues to work with governments and government organizations, community-based organizations, faith-based organizations, so as to scale up the fight against these three diseases and to realize its vision of the world free of AIDS, tuberculosis, and malaria.
Thank you, Titus. And now for a special report on combating the spread of Ebola and AIDS from Aysel Kurakaj.
Health diplomacy is in everybody's interest. Ebola and AIDS are the diseases that affect every country. Today, 35 million people around the world are living with AIDS. More than 11,000 people have died from Ebola. Global health communities, leading governments, international organizations are working together to fight against this disease. For example, United States has a national AIDS strategy. World Health Organization is working with countries to implement the global health strategy on AIDS. In addition to this, United Nations also has a program on AIDS. In the Ebola case, United Nations and World Health Organization established emergency health mission, and also United States and Canada made Ebola policies. Throughout these responses, technical experts, medical equipments are sent to affected countries.
Thank you, Aysel. And now, finally, a report on age-related health diplomacy from James Revert.
Among the many health-related issues afflicting the globe today, the prospect of a rapidly aging population is a major and growing concern, particularly in countries where the number of elderly people already have or soon will overtake the coming generations in terms of population percentage. Age-related health diplomacy on the global stage is closely tied to both economic and socio-cultural issues as well. Projects focus on building a comprehensive society accessible to all ages, recognizing the contributions by aging demographics to the development of society and the preservation of culture, and the inclusion of aging provisions in economic and social development policies. Central to these projects is an initiative called the Madrid International Plan of Action on Aging, or the MIPAA. The first global agreement of its kind, the MIPAA represents worldwide acknowledgement of such age-related issues and sets forth goals for the implementation of progressive solutions. The stage for age-related global health diplomacy is dominated by NGOs with a vested interest in advocacy for age-related issues, such as the AARP in the US and Age UK in Great Britain, as well as those with a wider variety of platforms like the WHO. Since international age agreements like the MIPAA are usually non-binding, direct implementation of target goals is left to these non-governmental aging advocates. Such entities are tasked with the lobbying of governments, drafting policies, and supporting legislation that falls in line with specific goals. Though not a direct player, the UN oversees many of these international project advancements, collecting reports from age advocacy NGOs around the world. Ultimately, age health diplomacy is a bottom-up approach that relies heavily on the global diplomatic action of such non-governmental organizations.
Diplomasia ya kilimwengu ya afya.
Küresel sağlık diplomasisi.
Globale Gesundheit Diplomatie.
Global health diplomacy.
Okay. Why you didn't switch up like that?
Hello.
Right.
Long-lasting insecticide-treated bed nets for the prevention of malaria.